Hi, here we are again with Karen, and I'm just going to introduce myself quickly if you haven't seen the other videos. There are 3 videos which will cover the full face rejuvenation. They're the upper third, middle third and lower third, and we're going to be doing the middle third now. I'm Rita, Deja Vu Aesthetic Training Academy and KOL for Intraline, and the product that we're using today is Intraline. And for the cheeks we need a higher G prime, so I'm going to be using Intraline M4 Plus. The plus means it's got the lidocaine in with it. Okay, so to start off with, oh, I can see a little bit of blood just there from before. Wipe that off. Okay, so to start off with, I want to find the zygomatic arch. Now you've got your zygomatic bone, and then the zygomatic arch is here. And for ladies, a sign of beautification is high cheekbones. So I'm going to find the zygomatic arch, which is just about here. I prime my needle. Okay, so I'm going in here. Gently aspirate to make sure I'm safe. And then inject very slowly. I'm going to put my finger under there and I'm going to pull back towards the temple. And I'm going to inject 0.1, 0.2 and come out very slowly. I'm then going to find the lateral junction of the eye. And I'm going to inject there again. So I'm going down to the bone. Aspirating. Pull back again, but make sure you've got your thumb underneath so it stays where you want it to, really. 0.1, again come out very slowly. Then I'm going to follow that line up and go up about ½ an inch. Again there. Aspirate. And maybe 0.05 of a mil there. Again, take it out very slowly. Okay, so what I'm going to do then is push this together so it all merges to make a nice high definition cheekbone. So you should be able to see now that this is lifting up higher than this cheekbone. Then I'm going to move on to the nasal labia fold. Now this is a very dangerous area. Got the alar fossa just here, and the actual angular artery comes in about here. So you really don't want to be injecting there. When you see people injecting up like that, that is exactly where the artery is. So you don't want to hit that. So I'm still using the high G prime, M4 Plus, and I'm going to actually inject. So as you can see, I'm going towards the opposite corner of the mouth. I'm going to lift this up to move that artery away. I'm going to inject down to the bone. Aspirate again. And then very slowly inject there. 0.1, maybe 0.2. Pull out slowly. And then I'm going to be pushing this up. Here's my little tissue again. So I'm moving it, just let me have a little look a minute. So you can see now this nostril is actually slightly higher than that one because I've pushed it up, which will give it the distance there as well. Now, she really hasn't got any nasolabial folds there. So I think that's that for the cheeks. That's all we need. So then we're going to move on to the lower part of the face.